We can kick this off. Hello, everybody. Thanks for joining today's webinar, the training webinar for North Carolina Rare Disease State Advocacy Day. We're honored to have you here and have you part of our Advocacy Day program on May 18th and 19th. For this webinar, we'll cover some important logistics and content information. If you would like to use any of the closed captioning options available for Zoom, you're more than welcome to do so. You should find that option at the beginning, at the bottom of your screen. Just hit the live transcript button to begin the transcription. Before we get too into the details of the event, I want to give a big shout out to our event sponsors. Without their sponsorship and their help, we would not be able to host Advocacy Day events such as these. So for today, we're going to talk a little bit about the logistics of the Advocacy Day. I will be sending out a recording of this webinar as well as all of the logistical information that y'all would need in an email either later today or tomorrow. So you'll have that, but we'll cover some important logistics on how the events on the 18th and 19th will work. We'll cover the legislative asks for the event. And introduce some of our partnering organizations. We won't cover all of the asks for the event, but we'll give you just a little bit of a preview of what we'll be talking about on the 18th and what you'll be talking to your legislators about on the 19th. We'll have a brief Q&A with the speakers, just so if there are any questions, we can address those. And then I'll give a brief presentation on how to advocate to your legislators. Then we'll do breakout sessions towards the end of the hour where y'all will get to practice telling your story. So, North Carolina Rare Disease State Advocacy Day. This is a day of action for North Carolina residents impacted by rare disease to get together, meet their state legislators, and share their stories. The objective is to help advance the priorities of the rare disease community. The event is in two parts. On May 18th, from 1 o'clock to 4 o'clock p.m., we will get together at the City of Raleigh Museum and hear from local organizations and advocates about our legislative asks and get trained on those asks. You'll get to connect with other advocates in your state and learn more about these issues and how the meetings on the following day will go. We will provide lunch starting at 12:30 p.m., and that's when doors will open as well. On May 19th, you'll have meetings with legislators from 9 a.m. to 5 p.m. We'll have you broken up into groups to go meet with your state representatives and your state senators and discuss the policy priorities that we discussed the day prior. Your meetings will be scheduled throughout that 9 to 5 period. And all meetings will be scheduled prior to the event. The dress code for both of these events is business casual. Here's a little heads up about our team. We've got Shannon Von Felden, our Vice President of Advocacy, Catherine Poe, our State Policy Manager, and then myself, Syed Dijaz, I'm the State Advocacy Manager. The three of us are part of the Every Life team, and we will be there on the ground with you on May 18th and 19th. If you're no longer able to attend, that's okay. Please send me an email so that I know to remove you from the meetings. It just makes proceedings with the event on the 19th much smoother if we know exactly who's coming and who's unable to attend. So if at any time between now and the day of the event, you're not able to come, just let me know. You all should have gotten multiple emails from me, excuse me, by this point. But in case you don't have my email address already, it is right here on the screen. And you'll get an email from me later today or tomorrow with all the event details. So here's how the conference and the meetings will work. The conference will be on May 18th at 1 o'clock. It will take place in the Women's Club classroom of the City of Raleigh Museum. This room is located on the third floor, and there is an elevator in the main lobby that will allow you to access that room. The City of Raleigh Museum also let me know that they'll be posting signage about our events, so you know exactly where to go to the moment you walk into the museum. Doors will open and lunch will be provided starting at 12:30 on the 18th. You'll be able to pick up your bag, you get some goodies from us, and get situated in the room. Meetings with legislators will be held on May 19th at the Legislative Building on 16 West Jones Street and the Legislative Office Building on 300 North Salisbury Street from 9 to 5. You'll get more information later in this presentation and later between now and the day of the event about when your meetings are, where they are, and with whom. Security at the museum and legislative buildings may require you to go through metal detectors as part of the security screening process. Just prepare yourself for, I always tell folks for our events to just prepare yourself for airport level screening. That's usually the most what a state capitol will ask for, but just a little heads up about that. On-site safety procedures and just policies around this. When you check in and you get your name tag from us, you'll find three different colored name tag lanyards. These will are available to help communicate your social distancing level based on the color of your lanyard. Red means no contact, greet from 6 feet away. Yellow means elbows only, and can ask for some space. And green means you're good to go with handshakes and high fives, and are okay with pre-COVID behaviors. Masks are optional for this event, but we ask you to respect everyone's choice regarding whether they want to mask or not. And we make every effort to make sure social distancing guidelines are followed and social distancing is possible. If you have any needs around this, feel free to communicate those to me ahead of time, and we'll do our best to accommodate. Event check-in, again, it'll be at 12:30 at the Women's Club classroom at the City of Raleigh Museum. The address for the museum is 220 Fayetteville Street. Please arrive on time because we will be starting promptly at 1 o'clock with speakers and presentations. We have a lot of material to get through as well as some guest speakers. So please arrive by that 1 o'clock time. Travel reimbursement checks for those that have applied for travel reimbursements. I will have those available to hand out to you during check-in. And just remember to grab your name tag and your preferred color safety lanyard. Lunch will start at 12:30. Now, parking at the City of Raleigh Museum. There are a couple of parking options available that are close to the museum. Here are some that I found, but there are other options available. Parking is available at the Moore Square parking deck located at 233 South Wilmington Street. The deck is free to use, and it's about a 3-minute walk from the museum. There is a paid parking lot at 313 South Wilmington Street, and it is a 4-minute walk from the museum. And there is street parking available near the museum as well. Parking at the Capitol. So I have sort of found the parking that's closest to the legislative buildings based on the recommendations the Capitol directly provided. There are a couple of visitors lots that I would recommend for this event. Since the buildings are located very close together, there are two in particular that stuck out. Visitors Lot 1, which is at 140 East Jones Street, and Visitors Lot 2, which is at 333 North Salisbury Street. Visitors Lot 1 is $2 per hour. It is located southeast of the legislative buildings, and it's about a 3 to 4 minute walk from the legislative buildings. Visitors Lot 2 is located on the ground level of parking deck 75 and is located at 333 North Salisbury Street. The parking rate's $2 per hour, and it too is a 3 to 4 minute walk from the legislative buildings. It's located northwest of those buildings. So between now and the event, you will receive an automated email from Advocacy Associates. Advocacy Associates is our scheduling platform. They will schedule meetings on behalf of this event in order to get you connected to your legislators. You'll receive an automated email that will allow you to set up their app in your phone. And it is through that app where you will know who you're meeting with, when, and where. So look out for an email from them, and please check your spam and junk folders if you do not receive your email. We're scheduled to ship out this information to you all through Advocacy Associates next week. So excuse me, please look out for an email next week from Advocacy Associates. We'll also send a video with login instructions to make sure that you're able to get into the app and are able to just navigate the app and know what's available. If anybody has difficulty scheduling or getting into their Advocacy Associates app, feel free to let me know, and I can work with Advocacy Associates to make sure you're set up well before the event. Inside the app, you'll see, as I mentioned, exactly who you're meeting with, where and when. You'll also be able to see your meeting groups and who you'll be with in each meeting. I encourage you to take a look at who will be in your meeting groups so you'll know to connect with them at our event on the 18th. Because it's good to know who y'all will be with so you can practice sharing your story together and figure out speaking order and just be more confident as you head into your meetings on the 19th. With all of that being said, I'm going to pass it over to our friends from the Bleeding Disorders Foundation of North Carolina to discuss the One Big Beautiful Bill and how it's impacting Medicaid in North Carolina.
Awesome. Thank you. Hi, everyone. Thank you so much for being with us here today. And thank you to the Every Life Foundation, especially Syed and Catherine, for asking us to be a part of this amazing opportunity. I'm Jasmine. I'm the Outreach and Advocacy Manager for the Bleeding Disorders Foundation of North Carolina. And with me here today is Charlene Cowell, our Executive Director for the Bleeding Disorders Foundation of North Carolina. Yeah, Charlene. Um, we're here today to hopefully give you some insight into HR 1, also known as the One Big Beautiful Bill Act. We just had our own advocacy days last week on the 27th and 28th of April, where we focused on the implications of HR 1, and what they'll have on our bleeding disorders community and North Carolina Medicaid. And so although we focused on bleeding disorders, we wanted to make it clear that this bill and its effects go beyond our bleeding disorders community and can apply to almost anyone with a chronic condition. So if you hear me slip up and say bleeding disorder, just know that I mean those with a chronic condition in general. We can go ahead and go to the next slide. Awesome. So let's start with what's already happened. So several provisions in 2025 may sound administrative, but they have real consequences for our community. The pause on Medicare and Medicaid rulemaking slows down enrollment and eligibility processes. For someone with a chronic condition, delays are not neutral. They can mean gaps in access to medication, missed appointments, or uncertainty about whether treatment will be covered. There's also a one-year funding block affecting certain providers, including family planning services. For women and girls with chronic conditions, this could limit access to critical specialized care that intersects with reproductive health. We also see pressure on rural hospitals. While there's funding available, it may not fully offset reduced capacity. So for patients in rural areas, that can mean longer travel times or fewer providers who understand someone's chronic condition. And finally, the expiration of enhanced premium tax credits at the end of the year means higher monthly costs. For many in our bleeding disorders community, coverage coverage is already a financial stretch. And so this pushes it further out of reach. And we can go ahead to the next slide. So in 2026, affordability and access become even more complicated. Changes to the Affordable Care Act mean that lower income patients may no longer qualify for the same financial help during special enrollment periods. That translates directly into higher premiums and out-of-pocket costs. There are also new requirements tied to tax filing and reconciliation. So if someone misses a step or makes an error, they could lose access to financial assistance entirely. And that's not about health, that's about paperwork determining access to care. We also begin to see the groundwork for community engagement requirements, often referred to as work reporting. And for people with chronic conditions, this is a major concern. as many individuals might appear able-bodied on paper, but still manage chronic pain. Um, so if the system doesn't recognize that, people could be pushed out of coverage despite having serious lifelong condition. Are there any questions so far? No? Okay, then we can go ahead to the next slide and I'll pass the mic to Charlene.
All right. So now we're going to talk about 2027, which somehow is only a few months away, it feels like. So in 2027, the policies are going to start taking full effect. Medicaid eligibility checks are going to start happening every 6 months, which is going to increase the risk of administrative churn. Even if somebody still qualifies for Medicaid, missing a notice or a deadline could result in losing coverage. As of right now, to my knowledge, we're not sure what required notifications are going to look like for North Carolina Medicaid patients. Is it going to be a letter? Is it going to be an email? You know, how much effort is going to be made to contact folks when this eligibility checks are coming due? So at the same time, work reporting requirements will become mandatory. This is where misunderstanding of bleeding disorders and a lot of other conditions is going to become especially dangerous because many individuals with a chronic condition could be categorized as, quote, able-bodied, even when their condition limits their ability to work consistently. So if they cannot meet the recording requirements or document exemptions correctly, they risk losing their Medicaid. And it doesn't stop there. Failing Medicaid requirements can also block access to Medicaid or marketplace subsidies. So if someone loses their Medicaid, they still might be able to or may not be able to afford the marketplace coverage that's available to them because they're not eligible for those subsidies. This is going to increase a gap where people are going to fall through entirely. Could mean delayed treatment, increased complications, and higher long-term costs. So we're really concerned about this. And next slide, please. So continuing in 2027 is going to be the reduction of the retroactive Medicaid coverage. So today, retroactive coverage can help patients, protect patients who experience a gap in paperwork or eligibility. Under these changes, the safety net is going to shrink significantly. For a parent managing a child's condition or an adult managing their own care, missing a deadline could mean being responsible for thousands of dollars in treatment costs, even more, with some conditions that would have previously been covered. So this is gonna shift the risk directly onto patients and families. And next slide. So now we're moving to 2028. Again, it's not that far off, although it seems like it, but it's really not. So in 2028, we're going to see a shift toward more active ongoing requirements for maintaining coverage. So the automatic re-enrollment in marketplace plans is going to end. Patients are going to need to actively re-verify their eligibility each year. For many, especially those that are juggling complex care needs, this is going to increase the risk of losing coverage simply due to administrative burden. We also see the end of passive eligibility for premium tax credits, which is going to mean more steps, more documentation, and more opportunities for disruption. So on the Medicaid side, new cost sharing requirements will become or will begin for individuals who are above 100% of the federal poverty limit. I just like to point out for folks who aren't aware of the federal poverty limit, it's a little bit less than $16,000 for an individual and $33,000 for a family of four right now. So if you make that or anywhere over it and you're on Medicaid in 2028, you should expect to be hit with some cost sharing requirements, which is just really sad because this isn't even a livable wage. For people with chronic conditions, even small copays can add up quickly due to the frequency and the cost of treatment. And then lastly, there's also a new home equity limit for long-term care eligibility. So this could impact older adults who may have assets but are on a limited income, which is going to put their access to care at risk. And next slide. So 2029, the focus is gonna shift from verification to enforcement. States will be required to collect and verify social security numbers and addresses to prevent multi-state enrollment. While this is framed as program integrity, it's just adding another layer of administrative complexity. For patients, again, this is just going to mean more documentation, more verification steps, and more chances for errors that could interrupt coverage. Because I think what any person with a chronic condition needs is more documentation, right? There's not enough of that living with a chronic condition. So for individuals who are managing a condition, even short disruptions can have a serious health consequence. And last but not least is our kind of call to action, which is when you step back and you look at all of this together, there is a clear trend. There's more requirements, more complexity, and more opportunities for people to lose coverage. Not because they don't qualify, but because the system is becoming harder to navigate. And for people who are living with rare and or chronic conditions where access to providers and treatment, if they have it, isn't optional, that instability really matters. And so that's why your voice and your experience matters in these conversations that we're going to have. Thank you. And then this last slide just shows, again, BDFNC is Bleeding Disorder Foundation, North Carolina. So when we went last week was our advocacy days. These were our three top asks is to please sustain Medicaid expansion, to properly fund Medicaid, and to include patients' impact in policy decisions because our stories and experiences are really what put faces to policies that they're making. So we want to be included and we want them to think of us when they're making important decisions that are going to impact our lives.
Thank you, Charlene and Jasmine, from the Bleeding Disorders Foundation of North Carolina for that presentation on Medicaid. To close out our Medicaid ask, I will pass it to Catherine Poe, our very own state policy manager from the Every Life Foundation.
Hello, everyone. It's so nice to see you all here today. So first, I'm just going to do a little bit of level setting about our state policy program and also just some details about the North Carolina legislature that we typically include in these presentations. So as you can see, this is our state policy grid at Every Life Foundation, and we tend to really focus on issues like newborn screening and genetic non-discrimination. But as of right now, we are also really focused on Medicaid, and this is at the top of our grid for every single state that we cover around the country, which is part of why we're talking about it today. But it is also particularly relevant in North Carolina at the moment. Next slide. So just a short breakdown of the North Carolina legislature. So North Carolina is a split legislature. Both the House and the Senate are Republican, but the governor is a Democrat. And this often comes into play in terms of negotiating different points of policy. A good example of this is the current budget in North Carolina. And sometimes things tend to happen in the legislature versus the governor along party lines. And sometimes they work together on issues. It really depends. But this dynamic is really important to keep in mind, especially because in the House and the Senate, Republicans have the majority by quite a bit. So this is just a dynamic to keep in mind. Next slide. North Carolina also follows the same process as Congress, generally speaking. So a bill must move through both the House and the Senate. It's heard by committees, and then it goes to the governor. North Carolina has a 2-year legislature, and it's important to know that bills introduced in 2025 cross over to 2026 if they pass through one chamber of the legislature. This session, as of right now, is the short session, which happens in the second year of the General Assembly. And 2026, the session ends around August of this year, which will depend on what happens in the legislature and whether or not they need more time or whether or not they end early, depending on the time frame that they actually end up using. Next slide. So I'm going to give just a little bit more of an overview about the details of North Carolina Medicaid in terms of the coverage and specific program details. So just so that you keep this in mind when going into your meetings, a majority of Medicaid adults are working in North Carolina. One of the things to keep in mind with Medicaid expansion and work requirements is that work requirements only apply to the Medicaid expansion population. So this is adults between the ages of 19 and 65 who were included in the Medicaid expansion who get access to Medicaid not because they have a disability or a pre-existing health condition, but because they have a lower income and therefore qualify for public assistance. This is really important to keep in mind because that is why work requirements matter so much. It is very specifically targeted to this population. And while most of those individuals are working, they haven't been required to report that previously. And so this is the new additional change for this population. It's also important to know that North Carolina covers a lot. There are a lot of variety in terms of the populations that access Medicaid. You can see that nursing home residents make up about 61% of these expenditures, but Medicaid also covers children. Not a lot of births are covered by North Carolina Medicaid. A lot of children are covered by the program. And then you can see that ages 19 to 64 population, not working age adults, that is where work requirements will be applied. Other population categories won't be impacted by those changes. Next slide. So recently, North Carolina made changes to their Medicaid program through House Bill 696. This is a budget appropriations bill. As many of you know, North Carolina has been in a prolonged budget crisis, and this bill was introduced and passed and signed by the governor recently in order to answer that budget crisis. This bill impacts Medicaid directly in several ways. So it will require individuals to prove compliance for 3 months prior to application or for at least 3 of the 6 months prior to application in order to be in that Medicaid expansion population and comply with work requirements. It also moves eligibility checks from quarterly to monthly, which is a rather significant jump in terms of paperwork and re-verification. There are also restrictions to self-attestation or an individual being able to claim that they are disabled versus having to have proof from a third party, so that's an employer, a doctor, that they're living with a disability. One of the main things, though, that we're often hearing from patients is cost sharing. So this bill sets cost sharing at the maximum amount of allowable services under federal law. Essentially, what this means is that if you go to the doctor, the Medicaid program is allowed to charge you for your share of the overall cost at the highest point that they're allowed by federal law. So this might change a copay amount from $0 to $30 or $0 to $50, depending on the given service. But for patients, as so many of you know, that are often inundated with several bills at a time, these costs could be really significant, especially if you're not used to them. And then lastly, and this is pretty important, North Carolina, the program, the bill gives North Carolina Medicaid the ability to implement work requirements to the best of their ability in line with federal law. It's not very specific about what that means, but that means that the Medicaid agency has a lot of authority to implement Medicaid work requirements. This is important because it means that the agency will have the ability to decide things like medical fragility or medical special needs. Those things will come under the agency rather than potentially the legislature. So when we're thinking about things like exemptions, so caregiving exemptions, this would be something that's decided by the agency. So these are still things that are up in the air and things that you can talk about in terms of how Medicaid impacts you and your family, which is why it's still important, even though this bill has passed, to continue to talk about how important Medicaid is to the rare disease community. So sharing your story, what does that mean, right? Everyone always says share your story, but typically what we're looking for in a legislative meeting is we want you to share your story in 2 to 3 minutes. So that's a paragraph of information. And when talking about Medicaid specifically, you want to lay out your connection to rare disease, whether or not you're currently enrolled in Medicaid, and how you apply or are enrolled in Medicaid. So let's say you are a family that receives home and community-based services through a waiver program, um, like the North Carolina Innovations Waiver or the CAPC program for medically fragile children. You want to mention that in your meeting to the lawmaker because that's relevant information, right? It frames how you respond and how you're related to the system. You can also talk about what it would be like to lose Medicaid for your family. What would the impact be like? Talking about cost in terms of medical care for your family is always a really great talking point. But sharing your story in these main components can kind of help you structure what the 2 to 3 minutes should look like. All right, that's my section.
Thank you so much, Catherine. We'll now pass it on to Sharon King from the National MPS Society to cover our second legislative ask for this event, House Bill 1166.
Yeah, thank you so much for that, Syed. And I want to thank RDLA and the Every Life Foundation for planning and hosting this advocacy opportunity for North Carolina. I'm a lifelong North Carolinian. I was born and raised in Raleigh, and I'm now living in Charlotte. I joined the National MPS Society last June as Chief Operating Officer. And the Society is an organization that I've held in the highest esteem for many years. I found the Society early in my personal rare disease journey that began in 2006 when my third child, Taylor, was diagnosed with CLN1 disease, more commonly known as Batten disease. CLN1 disease is a life-limiting condition that has no treatment or cure. And when I met with a geneticist and was told to take Taylor home and make happy memories while I could, you can imagine that didn't go over very well with me. And I can tell you, patient advocacy became a big thing for me from July 24th, 2006 to today. With family and friends, Taylor's Tale was established, and we can change to the next slide, Syed. So we joined with our family and friends to establish Taylor's Tale in early 2007 to use Taylor's story to raise awareness of rare diseases and to fund research for CLN1 disease. We quickly learned that raising funds to support treatment development was not enough. To really make a difference, we were going to need to collaborate with other stakeholders to advocate for health policy that address the significant challenges and the urgent needs of this rare disease community, particularly the shortage of meaningful treatments. The patient voice is so critical. No one understands the realities of living with a rare disease better than a patient or a caregiver. Taylor's Tale was involved in federal advocacy efforts, but state-based policy really held a significant interest for us. We knew that statistically, in 2015 timeframe, there were more than 1 million individuals in this state living with a rare disease. That's 1 million individuals whose voices need to be heard. And this need is made so much more difficult because it's a broad community, it's a diverse community, and it's scattered across the state. We think about North Carolina as having such a large population, but it actually has a lot of, a large rural community too. There was an urgent need for education and coordination of state policies that could address the unique challenges that those of us living with rare the challenges that we face on a daily basis. And by the way, Taylor's Tale was raising money to support drug development, and that was happening at a North Carolina-based academic research center. We knew that state-level initiatives to drive meaningful change for rare disease patients was critical, and so we were going after state-based policy. We realized very quickly that here. Fortunately, North Carolina Representative Becky Carney agreed with our vision that a successful state-based entity A rare disease advisory council could foster innovation, could offer some flexibility, and could help develop more tailored policy solutions on behalf of the rare disease community. And we were hoping that if we could be successful, what we would be supporting was something that could be modeled nationally. So, with Representative Carney's support, a bill to create the nation's first Rare Disease Advisory Council was filed in April of 2015, and it was signed by the governor into law just 4 short months later. Since that time, 32 additional states have legislated Rare Disease Advisory Councils, or RDACs. So, what is an RDAC? Next slide. An RDAC is an official state advocacy body that's established through state law or a governor's authority that provides the rare disease community with a formal voice in state government. Councils bring together stakeholders in the rare disease space, and these stakeholders include patients, caregivers, healthcare providers, researchers, industry. We think about access. So many stakeholders across the rare disease space. And we needed an advisory body that could bring these stakeholders together, who could not only identify but embrace these challenges and support the development of solutions in creating better outcomes for rare disease patients, the larger community. RDACs look different in almost every state. Every state that has adopted an RDAC, you can find different similarities, but also differences, because they're developed to meet the needs of that specific an individual state. So why are these rare disease advisory councils important? Next slide. North Carolina was a trailblazer. We were number one in establishing a rare disease advisory council. And we had a number of successes. 4 that I can point to very easily are 4 white papers that came out, published, most notably Newborn Screening and Early Intervention for the Treatment of Rare Diseases. It analyzed the current status of newborn screening in North Carolina in comparison to other states and identified future opportunities. And as North Carolina moved into newborn screening expansion, that white paper was a contributor to the education and the understanding for North Carolina to make those changes on behalf of babies, of the babies born in this state every day. Additionally, the council's work has set a precedent for other states and has demonstrated how targeted research and collaboration can influence policy and improve outcomes for individuals living with rare diseases. The impact of these initiatives extends beyond the rare disease community, and it really is benefiting public health as a whole. But as with any new big idea, we've also had some times of trial and error with our council here in North Carolina, but we've learned along the way. And among those learnings, we know the value of consistent leadership, of strong oversight, and the need for administrative support. This is not a group that comes together and just meets on a quarterly basis. It represents lots of expertise across the stakeholder community, and there's work to be done between the meetings. We were meeting every quarter, but there's a lot of work that happens in the in-between. And we knew that we needed consistency. We really needed more of, we needed administrative support ongoing, and we needed consistent, focused leadership all the time. We needed someone who could be at the State House on a regular basis. We wanted to be heard. We wanted to be seen. We wanted to be seen as an effective advisory body. We wanted our policymakers to reach to us to help with to provide the education and support for the big decisions that are being made on behalf of our community. So the North Carolina RDAC has been very quiet in recent years, not very active, and it is time now to reactivate the council and drive new opportunity in our rare disease community, and indeed for all North Carolinians. The burden of rare disease affects us all. Every citizen in this state is affected by the challenges that we as a rare disease community face. And we need for this RDAC to come back and be active once again. So what are the specific changes to the composition being proposed to the North Carolina Rare Disease Advisory Council? Next slide. HB 1166 provides for the reorganization and the funding of the North Carolina Rare Disease Advisory Council. The bill revises the composition and the duties of the RDAC, transfers the council from the School of Medicine at UNC to the Department of Health and Human Services, and will appropriate funds in the amount of $250,000 to the department to serve in covering the administration and support needs of the council. The designated appointees will continue to lean heavily on the inclusion of the patient voice, but it also is going to include new appointees, new stakeholders in the community. There will be an additional physician added through this bill for a total of 2 licensed and practicing in North Carolina with experience researching, diagnosing, or treating rare diseases, a hospital administrator representing a hospital in the state that provides care to persons diagnosed with a rare disease, a pharmacist licensed and practicing in the state with knowledge and experience regarding drugs used to treat rare diseases, a representative of a life sciences, biotechnology, or biopharmaceutical industry that either focuses on research efforts related to the development of therapeutic products for persons diagnosed with a rare disease, or has demonstrated the understanding of the path to commercialization for such products. It also will include for 2 representatives of a health benefit plan or a health insurer, and at least one of whom is a representative of North Carolina Medicaid Managed Care Health Plan. It also will include a genetic counselor with experience providing services to persons diagnosed with a rare disease or caregivers of persons diagnosed with a rare disease. There will be 15 members appointed by the Secretary of the Department, and then 3 appointed through the Senate, President pro tempore, the Speaker of the House of Representatives, and the Governor. So there will be a total of 18 appointees on the council. There are also revisions to the length of terms and administrative support, which will be provided, of course, again by the department. So what changes are specific to the duties of the RDAC? Next slide. Regarding those powers and duties, their main role is to advise the governor, the secretary, and the General Assembly on the following: the coordination of statewide efforts to study the incidence of rare diseases within the state and the status of the rare disease community, to help with the coordination of statewide efforts to increase public awareness and understanding of rare diseases, to identify policy issues related to rare diseases and the advancement of policy initiatives related to rare disease at the state and federal levels, and the appropriation of state funds to facilitate increased public awareness and improve treatment for rare diseases. Next slide. The RDAC will report annually and not later than January 1st on the activities of the council and its findings and recommendations regarding research and care in the state, and it will include recommendations for statutory changes and amendments to structure, organization, powers, or duties of the Advisory Council. And finally, what we've learned from watching other rare disease advisory councils in the nation is it's very difficult to operate without administrative support of a very important and highly active council, but we also need the funds to support that consistent leadership, to ensure that the council has a seat at the important tables, that it needs to, where it needs to be seen and heard. I can tell you from my years serving on this council, we did great work, but it was very difficult, to not have the structure and the support and that consistency, um, across the work of the body. I believe that these changes in this bill to reorganize and fund the council will be that next. Will take this council where it needs to be, back to a point where North Carolina is not only the founder, the trailblazer for this idea, but can once again carve that, instead of just will that this big idea will get us back on, we'll be back on the trail from this big idea, and will again lead for this people and our state and beyond. Thanks.
Thank you so much, Sharon. Sharon will be with us at the May 18th event to provide further education on this bill and make sure that we're all good to go. A big thank you to all of our guests. At this point, I'm just going to open it up if any of our attendees have any questions for our presenters today.
Yeah, I have a question about the bill that you were just discussing, Sharon. If is this a good time to ask?
Yes.
Yeah, so I guess my question is, so I'm appointed to the North Carolina State Independent Living Council, and we have no money. The federal government hates us, and ACL's been destroyed. So I'm just curious, how confident are you in the legislator being able to give $250,000 for this? Because I think it's a great idea. As somebody who's been behind the scenes with the funding, I'm very cautious about what that's able to do. So I'm just curious, and obviously I'm with this advocacy conference, so I will go in and talk about this. But this is just my kind of curiosity question about the confidence level we have to be able to get this passed, because again, I think it's really important. Thank you.
Thanks for that comment, Reese. I'm a positive person, and I believe, the first thing we need to do as we go in and talk with our legislators, the point is made about the necessity of these councils and the good work that they can do. I mean, we were the first, and we've been followed 32 times. Somebody else believes this is a good idea. And there are other councils that are doing great work. I consider them the gold standard. One of them is the council in the state of Minnesota. The executive director, they have a paid executive director because they have some funding, and they have that consistent voice. She is there, and she is accessible to the policymakers, to groups like the group you're involved in. And she is there to collaborate, to provide ideas. She shows up along with her council members. They also have members of their House and Senate who sit on the council. They attend those meetings. This is where we need to get. Minnesota, this person, her name is Erica Barnes in Minnesota. On day 2, after the bill was signed here in North Carolina in August of 2015, on day 2, she was first call of the day. How do I make this happen for my state? And there have been others. I'm positive. I know we need this funding because it will give us that consistent leadership, and it will also help cover the cost of the administration that the department has agreed to provide. I believe the most important part of the story you can tell when you go in, Reese, during Legislative Day, is that we started this. We are leaders. We know now, we've watched other states follow our lead, and here's how they're doing it. They're doing it well, but this is a difference. they're funded, and they have consistent leadership and administrative support. I think it can help us rise to our next iteration of the council.
All right, Sharon, I'm sold. Thank you. No, but I really do feel confident that we can get this from the state because right now, if you're trying to get any federal funding for anything, it's not going to happen. So I'm very confident in it. But I was just kind of curious. So thanks for answering my
Yeah,
question. And I definitely know how to phrase it now. So thank you.
very good.
Do we have any other questions for our speakers? All right. So seeing that we don't have much time left, I would ask that you hang on for just a little after. I'm going to quickly run through what some of these meetings will look like and just some tips, and then we'll do two very brief breakout sessions where we can kind of start practicing the language around telling our story. So how to advocate to your legislator. Here's a quick little crash course on what these meetings will look like. So here's some important things to consider just about yourself and where you are in North Carolina to bring in with you to these meetings. You've got contacts and networks. You are here to identify the problem solvers and influence them. You are going to be able to start a regular schedule of outreach to the folks that you'll be meeting with. This is an opportunity to share ideas. You can consider stories in the media that are happening right now in North Carolina, stories in the media that are happening geographically local to you, and stories in the media that may come out of this event or the issues that you're advocating on, especially the really big ones such as Medicaid and getting this RDAC funded. And then you will also have the opportunity to identify other advocates in similar situations that you'll be meeting here. But this is also something to think about between now and the day of the event of other folks in your life that may be impacted by the things that we talked about today. Remember, where you live matters. It makes a big impact on the type of care that you are offered, the quality of the care that you receive, the access to resources just in your area. And where you live matters plays a big part in the way policy making happens in your state. An in-person meeting with the legislator looks like this. Your state rep or senator will be in the room. If not, then it will be a staffer. Sometimes you'll have both. They'll join you in the designated meeting room in their office. Please start with a short round of introductions, your name, where you're from, and what your connection to rare disease is. Tell your 2-minute story. Keep it very brief, and we'll break down a little story structure to follow later in the presentation. And then make the legislative ask and do your best to connect your story to the ask itself. Leave time for the legislator or staffer to ask questions and learn more, and just learn more about what's being worked on at the state level right now. And then if the meeting goes really well, be sure to offer a photo opportunity and thank them for their time. These will be 30-minute meetings. I recommend 15 to 20 minutes of sharing your story and really talking about the issues, and leaving 10 minutes to help answer any questions that the policymakers may have. We actually do allow at this event, if you want to talk about other issues too, you're allowed to do that. But we ask that you prepare a one-pager on that legislative priority to bring in with you so you can leave that one-pager behind, and the legislator has material on what you are advocating for. I'm not going to spend too much time on the slide right now, but if you want a tip on how to put a one-pager on your issue priorities together, just let me know. We've got plenty of resources to help you put that together. Before you're meeting with your state legislator, you'll see in your app who you're meeting with. So I would do some homework and look into who they are, check out their website, their press releases, their social media, their newsletters. Just do a cursory Google search to see what you can find out about them. Learn about some of the bills that you want to discuss, either on your own, referencing the last slide, but then also the bill numbers of the bills that we're discussing here today. We'll have all this information for you on May 18th as well. Coordinate with your team and the other folks that you'll be in the meeting with beforehand to determine who will speak in what order and who will make the asks. And then practice your story with them. So you're not going in unprepared. You've already done a couple run throughs of what this story sharing experience will look like. And then just practice connecting the story to the ask. Because if you know you all will have powerful stories to share, but connecting them to the ask is what's going to drive success this event. What to do during the meeting to be successful? It's best to arrive early. We will try our best to have meetings scheduled with some gaps in between, so you'll have ample time to get to your next meeting. Sometimes that doesn't always happen, and you may need to hustle from one meeting to the next. But may fortune favor you in that regard. Do your best to arrive early. Be pleasant and respectful to the legislators and their staff. Thank the legislator if they've supported rare disease legislation in the past, and avoid talking politics. What I mean about this is just avoid the reds and blues of politics a little bit. Rare disease issues are nonpartisan and they can affect anyone on any part of the political spectrum, and we need champions in both sides of the aisle. So avoid getting into, the it of politics and try to keep things as diplomatic as you can. Um, Answering tough questions. This is a really important slide. I think from this whole section that I'm on right now, if there is one thing to take away from this is one of the things you should prioritize. If you don't know the answer to a question, um, say, I don't know, let me see if I can find the answer to that question and get back to you. This is really important. I actually love it when this happens in a meeting because what it does is it creates an opportunity for you to continue having the conversation after the meeting. You can continue to email them, can continue to be on the phone possibly. You've got some homework to do where you'll be able to be valuable to the legislator and help answer a question that may be very critical to securing their vote on these bills. So I actually prefer if I don't know the answer to everything in a meeting, I use that as an opportunity to continue the dialogue outside of the meeting and build a relationship. If the legislator just right out the gate is not supportive of your ask, say, I'm sorry, we don't feel the same way, but hopefully there's something we can work on together in the future. This keeps the door open for future collaboration when possible. And then after the meeting, send a thank you note or email to the legislator or staffer. Feel free to post on social media and tag us at Rare Advocates on all platforms, and follow up by email with some of the meeting materials that we'll be providing you, so you can send over a digital copy. We'll be able to help facilitate that and provide you digital copies of those materials to send over. If you need help answering a question, just let us know and we'll help you in crafting your response to your legislator. When you are making the ask, here are just some things to remember. You're in the driver's seat. It's your story. This meeting is about you and what you want to talk about. Balance facts and emotions. And really, feel free to be passionate about this, but connect it to the ask and to the bills of the day. And keep things brief because there are other folks in the room who have stories to share. We only have 30 minutes and we do need to allow time for questions as well. So there's just a bit of an art to the brevity of all of this. And then when you are crafting your ask, here's a good structure for it. You can talk about the problem that the bill relates to. You can talk about the solution, which is the legislation. And you can then make an explicit ask, asking them to co-sponsor or vote for the legislation itself. If you tell your story right before this, you can follow this ask structure to really drive things home. So for example, for Medicaid and implementation of HR1, you can talk about how Medicaid or how HR1 requires that states make changes to their Medicaid program with an emphasis on with folks or Medicaid states that have done Medicaid expansion. A solution could be to add strong work requirement exemptions for caregivers for both pediatric and adult patients. And the ask specifically is to please consider rare disease patients when implementing HR1 in North Carolina. Now, I ran through a lot of information real quick. We're definitely going to do another drill of this on the 18th. So if you didn't catch all that, no problem. For now, though, we are going to do breakout rooms. We're going to divide up into 2 rooms, and I'll give 10 minutes for folks to just practice talking their story out with a member of the Every Life staff. After that, I'll bring everybody back for just a minute or two so we can adjourn. But just hang tight. I got to assign rooms really quickly. Um, Give me just 1 second. Catherine. Okay. You should have an invitation to join a breakout room. If you haven't, just hang in there. I'll make sure you have an opportunity. And we'll bring people back in just a little bit. Wait for the others to join. Mariana, are there any questions I could answer for you about the event?
Yes, actually, Catherine already covered a few points of like additional asks. And one piece I didn't get to ask in our breakout session was the influence on insurance or of insurance in our advocacy messages. Um, as a whole, like beyond Medicaid and ACA, is there a particular piece with private insurance?
Honestly, so we're also covering a biomarker testing bill that we'll talk about more at the event. For that bill specifically, there is a insurance piece that can be talked about because it's like an insurance coverage bill. But as for Medicaid specifically, like a lot of private insurance companies are really impacted by people who are on Medicaid because it often sets the floor for health insurance reimbursement. It also like makes sure that people in the private market have cheaper coverage because everyone is covered as a result. So I would say that private insurance companies are still in the same ecosystem. And so they'll always be impacted by Medicaid coverage losses. But truly, the biomarker testing one is the most like direct health insurance impact. And we didn't cover that today, but we will at the event.
Yeah. Reese, Brandy, Dawn, are there any questions about the event that we can answer?
I feel ready to go. Thank you, though.
Of course.
Thank you. This was really helpful, and I really appreciate you hosting this.
Of course. It's our pleasure. We have almost 40 people signed up for the event, so it'll definitely be a bigger crowd than what's on the webinar today. This is usually how attendance tracks for these types of webinars. If you have any questions at all between now and the event, feel free to email me. I'll be sending out an email with all the information that we covered today and more. And we'll see you on the 18th. Thanks so
Sounds
much.
great. Thank you. Bye, all.
Bye.
Thank you.